Can cervical mucus indicate pregnancy after ovulation?
Hello, and welcome to this video where we will be delving into the topic of cervical mucus and its potential as an early indicator of pregnancy post-ovulation. This topic is crucial because understanding your body's signals can empower you to be more in tune with your reproductive health. Cervical mucus, also known as cervical fluid, can indeed tell us a lot about our bodies, including potential signs of pregnancy.
What is cervical mucus?
Cervical mucus is a fluid or gel-like discharge from the cervix, the lower part of the uterus that opens into the vagina. It changes in color, texture, and volume at different times throughout the menstrual cycle, and can give us insights into fertility, ovulation, and other aspects of reproductive health. Its primary role is to aid in fertilization by helping sperm travel up to the egg for potential conception, and to protect the uterus from potential pathogens.
How does cervical mucus change during the cycle?
During the menstrual cycle, hormonal changes influence the quantity and quality of cervical mucus. After menstruation, the vagina is typically dry with little to no mucus. As estrogen levels increase approaching ovulation, cervical mucus increases and becomes more slippery and stretchy, resembling raw egg whites. This is the body's natural way of assisting sperm to reach the egg for fertilization. After ovulation, under the influence of progesterone, the mucus typically becomes thicker and stickier, creating a kind of plug to protect any potential fertilized egg.
Can cervical mucus indicate pregnancy?
Changes in cervical mucus can potentially be an early sign of pregnancy for some women. After conception, the body starts producing more estrogen and progesterone. These hormonal changes can lead to an increase in the amount of cervical mucus. This mucus is often clear and stretchy, similar to the mucus observed around the time of ovulation. However, it's important to note that while a change in cervical mucus can be one of the signs of early pregnancy, it is not a definitive sign of pregnancy. Many other factors can lead to changes in cervical mucus, such as hormonal fluctuations, stress, and certain medical conditions. Moreover, these changes can be subtle and may be hard to notice without closely tracking cervical mucus changes throughout several cycles.
What other signs can indicate early pregnancy?
In addition to changes in cervical mucus, other early signs of pregnancy can include missed period. This is often the first sign of pregnancy for many women. Tender, swollen breasts. Hormonal changes might make breasts sensitive or sore. Nausea with or without vomiting, commonly known as morning sickness, though it can occur at any time of the day. Increased urination. You might find yourself needing to urinate more often than usual. Fatigue. Many women feel tired early in pregnancy due to rising levels of the hormone progesterone. Light spotting, also known as implantation bleeding, which can occur when the fertilized egg attaches to the lining of the uterus. If you notice these symptoms, it may be wise to take a home pregnancy test or consult your healthcare provider for more conclusive results. In conclusion, changes in cervical mucus can potentially be an early sign of pregnancy, but they should not be used as a standalone indicator. It's always best to listen to your body and, if you suspect you might be pregnant, consider a more reliable method.